classification of antibiotics.
Okay, sir. So classification of antibiotics, we have fluoroquinolones such as ofloxacin, moxifloxacin, levofloxacin. We have sulfonamides such as sulfamethoxazole, sulfamethoxazole sulfpyrin. Then we have beta-lactams such as penicillin, cephalosporins, ampicillin, amoxicillin. Then we have macrolides such as erythromycin, azithromycin,
Roxicillin,
clarithromycin, sir. Then we have.
Do you know among these one
tetracycline.
antibiotic is there? Azithro, Clarithro, Roxy. One antibiotic is there which is to be taken prior food. All the antibiotics we know we take after food.
Yes, sir.
So can you tell which antibiotic it is?
Prior food, sir.
Prior to food.
I'll read about.
It is azithromycin.
Okay, sir, I'll read. Azithromycin is taken after food, no, sir?
No, it is taken prior to food. No, we can take after food, but better results
sir.
comes with prior to food.
Oh, okay.
Check somewhere.
Sir. But okay, sir. In our hospitals, we prescribe after food.
You usually give after food only. It's very common,
yes.
But it comes up. Okay, now you tell me COVID discharge protocols. I have written few important questions for you.
Okay, sir. So COVID discharge protocols. So mainly we discharge. Mainly we keep the patients for 10 days after admission to monitor the vitals of the patients and the temperature of the patient. So we have to discharge after 3 days of the afebrile phase. If the patient is afebrile for 3 days, then we can, without antipyretics, we can discharge the patient. Then the patient should have oxygen saturation of 95%. He should breathe without oxygen support. We can discharge the patient, and his symptoms are such as fever, breathlessness. If all these are reduced, then we can discharge the patient, sir.
Okay, if I ask you about upper GI bleed.
Okay, sir. So upper GI bleed, most common causes peptic ulcer, sir.
Yes.
Duodenal ulcer or perforation leads to upper GI bleed. That's it, sir.
No worry. About lower GI bleed?
So lower GI bleed, we have Crohn's disease. We have rectal carcinoma. We have hemorrhoids. All these things, sir.
Okay, what are the third generation cephalosporins?
Okay, so third generation cephalosporin, we have ceftriaxone, cefotaxime, cefixime, ceftibuten. That's it, sir.
What are the risk factors for breast CA?
Okay, so risk factors for breast carcinomas are mainly PCOS, polycystic ovarian syndrome, then nulliparity. Then if the mother is not breastfeeding, it would lead to breast cancer. Then elderly age. In genetics, BRCA mutation also lead to breast cancer in genetics. Smoking, alcohol, all these can lead to breast cancer. That's it, sir.
What are the causes of pancreatitis?
So causes of pancreatitis. We have acute pancreatitis and chronic pancreatitis. In acute pancreatitis, the most common cause is a gallstone. So gallstone is the main reason for acute pancreatitis. And others such as infections can lead to pancreatitis. Autoimmune diseases can lead to pancreatitis. And any obstruction such as strictures, carcinoma, distal to the pancreas can lead to pancreatitis. And alcohol also. In chronic pancreatitis, the most common cause is the alcohol. Alcohol is the main reason for chronic pancreatitis, and trauma and drugs. Some drugs causes pancreatitis. Then that's it, sir.
Can you tell me about stab injury?
Okay, sir. Sir, stab injury, first we have to stabilize the patient, sir. ABC, airway, breathing, and circulation. And we have to look for the circulation mainly. If he is hemodynamically stable, we can proceed with investigation and treatment. If it is hemodynamically unstable, we have to start the blood transfusion as soon as possible, and we have to do laparotomy and to close the wound as soon as possible, sir.
Okay. IVC filters.
Okay, sir. I need to read about it, sir. I need to read about it.
Okay, tell about ACL and BLS.
Okay, sir. ACL, we have advanced cardiac life support, and BLS, we have basic life support. In basic life support, sir, if someone is collapsed in public, we have to we have to go to the patient. First, we have to call for help. Then we have to assess the pulse for the patient. Then if the pulse is too low, we have to start the CPR as soon as possible till the medical team arrives. So we have to give 30, if I am the only rescuer, I will give 30 CPR, 30 chest compressions plus 2 breaths I will give. If 2 rescuers are there, we have to give 15 compressions and we have to give 2 breaths and we have to continue the cycle, sir. And if the medical team arrives, we have to give the patients to the medical team, and the medical team will take care of that. The medical team have many advanced life support procedures, such as they have oxygen, they have a defibrillator, automated external defibrillator. They will use that and they will resuscitate the patient, sir.
Okay, you tell about hernia.
Keep reading. Okay, sir. Sir, hernia is a protrusion of organs through abdominal defects. So we have two major hernias, sir, direct hernia and indirect hernia, sir. So in direct hernia, sir, the hernia protrudes through the defect in the posterior wall. In indirect hernia, the hernia enter the inguinal canal and it comes out through the superficial inguinal ring. So we have direct hernia, indirect hernia, and other types of hernia are we have obstructed hernia, we have strangulated hernia, we have a if it comes in inguinal, it is inguinal hernia. If it comes in femoral, we have femoral hernia. And regarding the content of the hernia, we have many types. It is if it is a Merkel's diverticulum is a content of hernia, it is called Litter's hernia. If it is a part of circumference of the bowel is the part of hernia, then it is called as Richter's hernia. So there are many types of hernias. So first, most commonly we have inguinal hernias. So how to differentiate the direct and inguinal hernia? We have 3 tests, ring invagination test, little finger invagination tests, and the size. In femoral hernia, it is a globular. In indirect hernia, it is a fusiform-like shape, so we can differentiate that. And we do hernia repair surgeries. Most commonly done hernia repair surgery is Liechtenstein hernioplasty, sir.
Tell me about the most important question which is being asked mostly in these interviews: ectopic pregnancy.
Okay, sir. Sir, ectopic pregnancy. So the implantation occurs other than uterus is called as ectopic pregnancy, sir. The most common site for ectopic pregnancy is ovary, and other sites to be implanted or abdomen and ovary and abdomen, ovary, cervix. So fallopian tube, these are the other sites the implantation can occur, sir. So ectopic pregnancy, first we have to take a proper blood investigation. Mainly we look for HCG of the patient, sir. So if the HCG is doubling after 2 days, then we can say, okay, this is intrauterine pregnancy. If it is slowly increasing rather than doubling, then we should suspect ectopic pregnancy. So if it increases more than doubling, then we can suspect molar pregnancy and also. So after and another investigation to diagnose ectopic pregnancy is imaging modality such as ultrasound. Most commonly, transvaginal ultrasound is done to look for ectopic pregnancies. So after diagnosing ectopic pregnancy, we have to look whether it is treatable by medication or it is treatable by surgery. So if the size is less than 5 centimeter and if the ectopic pregnancy that is not ruptured and the HCG is less than 2,500 international units, then we can follow medical treatment. That is, we give single dose methotrexate And after 7 days, we have to look for again the HCG, and we give methotrexate like 3 doses. So if the patient is hemodynamically unstable, and if the pregnancy is ruptured, and if HCG is more than 2,500 international unit, we should do surgical repair, sir. The surgical repair, we do salpingectomy to the patient, sir.
What is whiplash injury?
Okay, sir. Whiplash injury occurs when the patient is in the same motion, and if the sudden resistance comes, the patient may go to one front. So this causes the brain to move to one front inside the skull. So this causes concussion to the brain, and it causes whiplash injury, sir.
And what is raccoon injury? Raccoon signs.
Okay, sir. So Rakan sign is also called as Panda sign. It mostly occurs in the anterior cranial fossa injury. In the anterior cranial fossa injury, the blood seeps down and it forms around the both eyes. So it looks like raccoon or panda. So it is called as raccoon sign or panda sign.
What is battle sign?
Sir, battle sign is middle cranial fossa injury, sir. The blood seeps out and forms behind the ear. So the bruise is formed behind the ear. It is called as a battle sign, sir. Mostly occur in battlefield. So it is called battle.
And what is barotrauma?
Okay, sir. Sir, barotrauma is occurring when the person is exposed to high air pressure. So the symptoms are bleeding from the nose, bleeding from the ear, and slurred speech, and the patient may have lung injury, and so on, sir.
Speak on intubation.
Okay, sir. Sir, intubation techniques. If first we have to assess the Glasgow coma scale of the patient if the patient arrives. If it is less than 8, we have to intubate the patient. And if the patient is not breathing spontaneously, we have to intubate the patient. So, firstly, we have to take we have to stabilize the ABC of the patient. Then we have to give an IV line to the patient. Then we have to take a laryngoscope in the left hand. We have to gently pass the laryngoscope down the throat. We have to see for the epiglottis. And after seeing epiglottis, we have to take the ET tube. We have to insert it. Then required centimeter is attained. Then we have to secure the ET tube with inflating the pressure cuff with the air in the syringe. Then after placing the ET tube, we have to connect it with the ventilator, and the ventilator will take care of the patient. So all these procedures should be done in proper aseptic precautions. So we have to handle it with proper aseptic precautions, sir.
Good. And can you tell me on HAPE, HAPE?
Okay, sir. HAPE is also called high altitude pulmonary edema, sir. In it occurs because when the person reaches a certain height, that is more than 3,000 meter, 3,000 meter in the hilly area, the patient may develop a HAPE, high altitude pulmonary edema. So it is because the capillaries are inside the capillaries there are increased pressure, and the capillaries are leaking, and all the bloods come to the lungs, and it develop a pulmonary edema. So the patient may develop breathlessness, chest pain, and so on. So we have to treat the patient advise the patient rapid descent, come down possibly, and we should give him nifedipine, we should give him dexamethasone to treat the HAPE, sir.
What does stove chest means? Stove chest. It is also known as frail chest. Can you explain about it?
Okay. Okay, sir. Sir, flail chest occurs mostly in the trauma to the thoracic region. So, a flail chest is described as more than 2 rib fracture in the same single rib, or 3 consecutive ribs. It is called as flail chest, sir. So, the flail chest sometimes may lead to pleural effusion, pneumothorax, and so on. So, if it is not complicated, we have to treat the patient conservatively. If it is complicated with the pneumothorax cases, we have to give the patient intercostal drainage, proper ABC, give oxygen to the patient if needed, and we have to treat like that, sir.
Can you tell on frostbite?
So frostbite occurs when the temperature is too low, that is below 0 degrees Celsius in the winter places, and it shrink the capillaries. The very low temperature, it shrink the capillaries, and it will not allow the blood to reach the places. So the toes, mostly it affects the periphery such as hands and toes. So the toes may go for gangrene, and sometimes you have to remove the toes for that. So mostly very low temperature shrinks the capillaries, and it does not allow the blood to flow through the digits, and the digits may go for gangrene. This is called as a